My guest today is Dr. Stephen Sinatra. He is one of the most highly respected and sought after cardiologists whose integrative approach to treating cardiovascular disease has revitalized patients with even the most advanced forms of illness. Previous to working with Healthy Directions, he has more than 40 years of clinical practice, research, and study by starting his career as an attending physician at Manchester Memorial Hospital in Connecticut, where he then went on to serve as chief of cardiology and director of medical education and other esteemed positions. Dr. Sinatra is also founder of the New England Heart Center, where he became known as one of America's top integrative cardiologists by combining conventional medical treatments for heart disease with complementary nutrition, anti-aging, and psychological therapies. So, ladies and gentlemen, let's welcome back our esteemed guest today, Dr. Stephen Sinatra. Welcome back, sir.
It's good to be here, and thanks for that really nice introduction.
Well, you're very, very welcome. And I know that the last time that you and I got together, we had an amazing discussion that heartbreak is real. And I must say, it was a very, very popular episode. And I believe that so many of my listeners learned a lot with the correlation between heartbreak and cardiovascular health. And you did a wonderful job.
Well, thank you. Thank you. In fact, it was so powerful. That's why I wrote that book, Heartbreak and Heart Disease, because as a heart specialist, I saw the correlation over and over again. So if we can help some of your listeners, that's wonderful. Wonderful.
Well, and for those of you who are watching right now, if you're wondering about the episode of Heartbreak is Real, just go over to my podcast, Life Changing Wellness, and it'll be right there ready for you to listen to. And let me tell you something, the information that Dr. Stephen Sinatra has brought forth in the areas of heartbreak is real, and the correlations to cardiovascular health is nothing short of phenomenal. So you will learn a lot and probably bring you a lot of peace at the same time. Well, Dr. Sinatra, I understand that we're going to talk about allergies today and what is actually the real connection between allergies and heart disease.
Well, it's sort of simple in a way because allergies are really a source of inflammation in the body. In other words, we get runny nose, sometimes we get cough. Sometimes we just can't sleep because our immune system gets on wide alert. Now, what happens? It's an inflammatory response, and we know that inflammation is the root cause of heart disease. In other words, it's not cholesterol like we thought about decades ago. It's inflammation. So the way allergies work, it sets up an inflammatory response. Now, if this is chronic, year after year, and if it gets worse and worse and worse, and if it gets severe, then the immune system gets on hyper alert. The inflammatory mediators come into play, and there's a whole cascade of events that eventually can lead to inflammation of the smaller blood vessels in your brain and your heart and the rest of your body.
Well, what are some of the common causes of allergies today?
Well, for me, and the reason why I'm speaking from Florida now and not from my state of Connecticut, is that I lived in the Connecticut Valley, and the pollen used to swirl around for like April, May, even into June. And I'll tell you what, I saw doctors because I developed extrinsic asthma. I had asthma in my 40s. I said I couldn't. I never had asthma as a kid. But when I researched the literature, I realized I had the extrinsic varietal, and it was due to pollen, because pollen sets up the inflammatory response. And I was on drugs, I was on steroids, I was on antihistamines, antibiotics. And I said, wait a minute, there's got to be a better way. I saw allergy doctors, I tried to get desensitized, I did everything. You know what worked? I moved out of the state during the pollen season. Now look, I have that luxury, so to speak. A lot of people can't, but even staying indoors has an advantage over going outside. Once people go outside with a lot of pollen, who are sensitive, they get this overwhelming inflammatory response, and it sets up so many cascades of reactions that a lot of these poor people feel miserable. And again, I was there. I felt it.
Well, even my mother, she'd always lived in Texas. Thought there was a great idea to move to northern Georgia, and literally during pollen season, the whole place is just painted yellow, and she had to do the same thing you did. move out of the state. So she came back to Texas just to get away from the heavy pollen, because Georgia's very heavy in pollen compared to Texas. And here, right when spring starts, everything turns yellow, and then we get that last burst when all the pecan trees start to
Right.
bud and bloom, and it just turns yellow again. But let me ask you this, because you brought up something very important that millions of Americans right now deal with, and that is they use so many over-the-counter allergy medications to ward off the allergy symptoms. It doesn't cure allergies, it's basically just fighting the symptoms. Are these things actually useful?
Yeah, I mean, listen, when people are miserable with, runny eyes, they can't sleep at night, itchy eyes, if they want to use some of these antihistamines, that's fine. That's fine. Now, a guy in your age group, you're going to have no problem with antihistamines. But me, if I started to take some of these antihistamines because of my aging prostate, for example, I mean, I could develop acute urinary retention. I mean, I've seen it happen. When I was a doctor in my 40s and 50s, and I was treating guys in their 70s. Now I'm in my early 70s, and now I can't take antihistamines. I just can't do it. And to anybody listening to this broadcast, if you are a male and you are suffering from allergies, use these allergy meds with extreme caution, because again, acute urinary retention in the male is a medical emergency. I've seen it, unfortunately, more than a half a dozen times, and it's frightful. It really
Well,
is.
that explains, as you read the packages of these over-the-counter allergy medications, that they do list that if you have BPH or an enlarged prostate, you need to be aware of that. Now, that's something that I just learned from you, that it actually causes urinary retention. I was kind of
Yes.
wondering if it was causing a much maybe more of an enlargement of the prostate.
No, I don't think it enlarges the prostate. I think it just has an impact on basically the flow of urine through an enlarged prostate. Because a lot of men my age, we take alpha blockers and we take estrogen inhibitors. I mean, I take alternatives. There's so many things you can do, but I mean, you don't want to get into that trouble. If you're a female, I don't see any contraindications. I really don't.
Well, then let me ask you this, because I know with antihistamines and in the natural world, we have things like nettle leaf, we have quercetin. Those are
Oh,
very
now you're
common.
talking. I love this. This is what I use.
Yeah, well, I use both of those because both of them actually have a great affinity to prostate health in men. So to
Got
me, even though they're antihistamines in a very minor way, they benefit our prostate. So in a way, we get the benefits of both worlds when we use things like nettle or quercetin.
Oh yeah, both very very good. Especially now, quercetin is one of my top go-to nutrients in the COVID-19 era, and basically I love it. I've been taking quercetin for decades. It
Yeah.
does so many things right. And by the way, one of the reasons why I got into quercetin at such an early age, when I was in my mid to late 30s, I came across the Zuplin elderly study. Have you ever heard of this study in Holland?
No.
It was, boy, an amazing study. They looked at aging Dutchmen. These guys are in their 70s, 80s, and 90s, and they followed these men for decades. And the end point of the study was death. They didn't care if you died of a heart attack, a stroke, or cancer. They didn't look at that. They just wanted to see how many years you lived. And this was a correlation. The more quercetin you had in your bloodstream, in other words, if you were eating onions, onions are a great source of quercetin. The more quercetin you have in the bloodstream, the longer you live. And they drew blood levels of quercetin. Now, where do you get quercetin from? Well, onions is number one. Number two is black tea. Green apples are number three. So they looked at the diet of these Dutchmen and they based longevity on quercetin. Now let's go back or ahead 50 years now. Now we're living in the COVID-19 era. Quercetin is one of the best, bioflavonoids you can use to combat respiratory illness in the lung as well. So quercetin has always been a go-to nutrient for me, and now it's even more go-to because again, it's not only COVID-19. there's so many more, viral-like syndromes we're going to be seeing over the next few years that quercetin is a must to put in your medical cabinet right now. And
Wow.
it's inexpensive. That's what I like about it.
It's inexpensive, and I'm kind of glad you got excited about it because I'm like you. I have been using quercetin for years, and I don't take anything less than 500 milligrams a day. And there are days when I'll take 1,000. There have been days I
Yeah.
took 2,000, and it was kind of funny because many years ago, I ended up with a prostate infection. The doctors, the antibiotics can't reach the prostate
Right.
effectively. So I'm like, okay, what can I do? So I did the research. I kind of like do research like you. And I thought, oh, quercetin. And I loaded up on it and it knocked it out. It took the discomfort and the pain away. And I have been a loyal quercetin user ever since. So I've probably been taking quercetin for over 20 years now. I love it.
Yeah, and again, if you're a tea drinker or a coffee drinker, I alternate. I do coffee, and now I do black tea and green teas. I love green teas, and a green tea has a lot of anti-inflammatory stuff in it as well. So, this is really important because certain foods are really good for an aging male, especially like myself.
Well, wow. Ladies and gentlemen, you can't get that kind of information anywhere else. And you've heard it from the doctor himself. Well, Dr. Sinatra, what is the best diet for someone who is struggling with chronic allergies? What foods will help them?
Well, first of all, what I learned, again, I had the affliction myself and being a doctor, and I wasn't a respiratory specialist, but I was close to it as a heart specialist. Um, I found that the more gluten I took, even though gluten wasn't popular years ago, but I realized that if I was taking a lot of wheat, a lot of flour, that's tend to flare things up. Sugar was the other thing. Sugar flared things up. So I gave up sugar, and I tried to, massage my diet because I realized that certain foods were sort of triggers, and it's all by trial and accident. But if people realize if they're eating a lot of bread or a lot of semolina pasta or like white noodles, stuff like that, or potatoes, if they're eating a lot of carbohydrates and a lot of sugars, and they realize, geez, I'm feeling worse, I'm not feeling better, they may get the connection and modify their diet. I always found that fresh fruits and vegetables was the best thing to do, and overload on garlic and onions and kale. Bringing nitric oxide to the table. If you wanted protein, migratory smaller salmon, sardines were good. Things like this. Smaller fish in the Atlantic are good. I always worry about mercury contamination or pollutants that way. I even had people tell me that on seaweeds, on certain seaweeds off the Maine coast, or even the seaweeds, off the coast of Korea, but you could buy these in health food stores. People told me the seaweeds improved on allergies, and it made sense as well. So there's a lot of tools we can use in our chest. You just got to be smart. You got to look at these things. And the most important thing I would tell your listeners would, if they have a meal and all of a sudden, a few hours later or the next day, they feel miserable, they got to think in their head, perhaps it was something I ate that triggered my pollen allergy even more. That's what happens. Because here's the one thing. When people develop allergies, it's like a horse's tail. You ever see a horse's tail where it has all these like hairs in it? Well, the more allergic you get, the worse you get. But the problem is you get more allergic to other things later on, like a horse's tail. So once allergy afflicts you, it can go on and get worse and worse over time. So you have to figure out by trial and accident that certain foods can trigger allergies. We talked about pollen, of course, that can trigger allergies. Heavy metals can trigger allergies. There's a lot of things that trigger it. And again, since I was so allergic myself, I feel like I'm sort of a mini expert on it.
Well, you bring up foods, and I think with foods themselves, a lot of people need to realize that if they eat something and they have an allergic reaction, they need to not necessarily blame the actual food. It could actually be an ingredient in which they use in that food. So like you said, It's trial and error trying to find out exactly what the offending property is. So you may not have to throw out the chicken. You may have to throw out one of the spices that could be triggering an allergic reaction.
Correct.
Well,
Well
then
said.
let me ask you this, because you and I really got excited about talking about quercetin. What are your top 4 herbs and supplements for allergies and as well as heart health?
Well, I love vitamin D. I mean, this is an inexpensive supplement. I love it. Um, you know, where I live in Florida right now, because we walk out into the sun and stuff like that, we get a lot of vitamin D from the sun. And remember, it's the cholesterol in your skin that, with combined with the sunlight, activates vitamin D3. And this is a great immune supporting nutrient. In fact, with COVID-19, you can take this one to the bank. The higher your vitamin D levels, like I talked about quercetin levels in the aging men, but the higher your vitamin D levels in your serum, the more combative ability you have against COVID-19. In other words, I've seen studies to show that if people had blood levels of 30 to 35, which is sort of a good range, um, they didn't get complications with COVID. But if the blood levels were down to 10 to 15, like a lot of people north of Atlanta, we talked about Atlanta, a lot of people north of Atlanta have these blood levels because they don't get the sunlight. These people had more complications with COVID-19. So, and vitamin D is great stuff for the heart. I mean, I have to tell you, this is one supplement that I take daily. I take at least 2 to 5,000 units a day. I check my blood level at least once a year because my blood level is around 60, and that's where I like it. I like it twice over 30. You don't want blood levels over 100. That can be into the toxic range, but it's a simple blood test. You can ask your doctor, Ward. It's so simple, and it's
Yeah,
inexpensive.
it is very inexpensive. And not only that, you bring up a great point about where we live. You're in Florida, I'm in Texas. Uh, we don't see the great COVID numbers in the South as we do in the North. And I think there's a very strong correlation with the amount of vitamin D that a person actually has in their body. And here I spend so much time outside. I mean, my average outdoor time is probably an hour a day.
Great, and I hope when you're outside, you're walking a little barefoot too, because grounding. I don't know if we've ever done a show on that, but I'm, I'm writing another book. Get grounded, get well. That's the title of it. And I got to tell you, in 50 years, Ward, next coming May, May of 2020, I guess 2022. It's going to be my 50th year of graduating medical school. And I'll tell you my 2 greatest discoveries. And I've written dozens and dozens of papers, and I've written over 20 books. It's CoQ10 and grounding. They're both electron donors. They're both phenomenal anti-aging, constituents, so to speak. But try to walk barefoot, get your vitamin D at the same time, and these are God's simple cures, so to speak, to really invigorate the body.
There is. And, I have read about grounding. I like to go outside in the backyard barefoot. A good 15, 30 minutes a day is
Oh yeah.
fantastic. And, I even saw a study about grounding that if people would do this every single day, that a lot of people will find that even the pain that they experience in their body, many people were showing as much as an 80% reduction in pain just by going outside and getting grounded by going barefoot. And ladies and gentlemen, this means standing in the grass, not on concrete,
No
not
concrete
on
works.
wood or
Concrete works.
material, directly to the ground.
Asphalt doesn't work. No
I said,
asphalt, boy. Asphalt, because that's man, that's sort of synthetic.
mhm.
But concrete, like concrete sidewalks, you're grounded. You're grounded.
So it's concrete's okay, but asphalt is a no-no.
Right.
All right.
Asphalt's a no-no.
All right. Well, I'm glad I got clarification about that because I was reading some things and I'm just trying to make sure that I'm doing the right thing. But I know one thing, when my feet touch the grass, I know I'm doing something great for my body. Well, let me
You
ask
are.
you.
You absolutely are. You're healing your body and you're attenuating the autonomic nervous system. Remember, you said it. When people are in pain, the autonomic nervous system, the fight-flight response goes up, it soars. The minute you ground, you're balancing the autonomic nervous system downward and you're bringing up the parasympathetic upward. So that's why you're seeing a lot of pain relief. It has to do with autonomic discharge, which is attenuated by earthing.
Yeah, and I also think too that by just standing on the grass, for a few minutes every day, I think that also helps to improve our overall immune system as well, which is even more important today than ever before.
Right, and you know what? I don't know. I'm wearing these now, but the shoes I wear, these are like little loafers, you know? I mean, I don't know if we're going to talk on the grounding, but see, if you see this sole, this is graphite. This is all leather. This is like a moccasin, so to speak, like what the Indians wore, in Texas and in the plains and stuff like that. And when you're grounded, even when you go outside and you're walking on concrete or grass or whatever, or brick will ground people as well. You're taking in that Schumann energy, that 7.83 hertz, it's like it's like the humming of the earth. When you're taking that energy, oh my God, great things, including thinning of the blood. I mean, we wrote that paper years ago. Your blood thins when you ground. And one of the reasons why we're seeing all these COVID-19 complications. Oh, by the way, there was a doctor in Iran who were taking COVID-19 patients who needed ventilators. He put patches on their lungs, and guess what? They oxygenated. And the reason being because grounding thins the blood. With COVID-19, we get enormous clotting of blood. So, when I wrote that paper 10 years ago, I thought it was the greatest paper I ever wrote in my lifetime. I mean, I've written dozens and dozens of peer-reviewed papers. Boy, I couldn't get that published in an international cardiovascular journal or even an American journal. I was going crazy.
I could
the
imagine.
Researchers thought I was a quack.
Well, I don't want to get too deep into the whole COVID situation, but you and I know that, let's just say everything that goes through the media is not exactly kosher right now when it comes to that subject. And you bring forth truth, and of course, people would like to hide that. So, ladies and gentlemen, you are getting information today that you have never heard in the last 14 months that will not only save your life now, it could have saved lives last year if that information was out there and available and everybody jumped on the bandwagon and really promoted it. So we know vitamin D3 is vital. Grounding is vital. And you know what, Dr. Sinatra, I'm going to have you back again so we can talk about grounding, because I want to know more about what your research is showing you, because there's just so much more to it. But I know that we're talking about allergies today, and I have so many viewers, so many listeners that deal with allergies. I want to ask you a question because I get this question all the time, and I know you're the man to ask. Are neti pots useful for allergies, and how would you use them so that way they're effective for you?
Great question. And the neti pot is easy. I mean, it requires, getting a small pot. You insert the spout into your nose. You tilt your head to one side. In other words, you're flushing your nasal, pharynx. Other people will take a hot shower before bedtime or in the morning because the pollen gets on their hair, it's on their skin, then it gets into the pillow at night. But when people take a hot shower and they're breathing in the steam, that too can act like a little neti pot. The other thing that I do, and actually it's sort of a COVID-19 remedy as well. I mean, if you want, Lord, we can talk a little bit crazy, but I don't think it's crazy. But when I make tea or coffee in the morning, I use a pot where it steams through the top, and then I'll open up the top and I'll put my nose over it, and I'll breathe in steam. So when you breathe in steam for like a minute to 2 minutes, and suppose you were exposed to COVID-19. Let's suppose you came across somebody who had the virus, who had a fever, who was coughing all over you, and you said, "Oh no, I've been exposed." Hey, kill it with steam. You can see the virus sits in your nasopharynx for a few days before it goes into it locks into the ACE2 receptor in the lung. So if it's in your nose, hey, steam or a neti pot with saline in it or something like that, any of those varietals, especially hot steam, breathing it in will kill that virus.
You know, that's funny that you bring that up. I had a colleague who had a article uh, published about nasal health related to COVID, and it was published out into the mainstream media. The article lasted one day and it disappeared in 24 hours because if people knew to keep their nasal passages clean even before they go get a COVID test done, that test should register negative because I know for a fact that the PCR test that people are using shows over a 90% false positive, that people think they have COVID, but they don't because the test is total junk. But if you keep your nasal passages clean, basically on a daily basis, we would see COVID go away tomorrow.
Oh yeah, no, I agree. I agree. And again, there's some of us that have, broken noses in athletics and stuff like that. I mean, that was my issue years ago when I was in high school and college. But basically, like I said before, when I'm in that hot shower or in the morning when I'm making tea, that steam is so critical because it makes you cough. All of a sudden, you have a need to blow your nose, and you're literally cleansing the nasal passage, and that's crucial in any viral pandemic. I don't care what the virus is because it sits there and it recirculates through the body, and again, it locks into the receptors of the lung, and et cetera, et cetera. It's a snowball going downhill. You can melt a snowball like that.
Well,
Oh,
then let me ask you this, doctor, because for a lot of people today, with the whole confusion of the media, confusion of medical reports when it comes to COVID, it's very difficult for the layperson to know the difference or be able to tell the difference between COVID-19 and allergy symptoms.
oh
How do
yeah.
you decipher between the two?
I think that one cutting symptom would be fever. People that I've spoken to who have had COVID, and I've treated, people, lots of them by phone, and we've used all sorts of stuff for COVID. But like fever is the one thing that is serious. Now, can people develop a very low grade fever with allergies? Yeah, occasionally they do. They can. Um, the loss of smell, the loss of taste, much more common with COVID. I mean, could it happen in somebody who's severely allergic? Possibly. In other words, but it's very transitory. You know what I mean? So I think fever, loss of smell, loss of taste, overwhelming dry cough. Some people with allergies get a cough, but it's usually more of a productive cough. With COVID, it's more of a dry cough. So, sometimes it's hard to distinguish. And I'll tell you this, Ward, the bookkeeper in my office in Connecticut, she developed COVID and she thought it was allergies at first. That's what she thought at first. And she came into the office and exposed a couple of other people. So basically, it's just important for your listeners to try to distinguish between the two. But again, once you get a fever, I think you're in the infectious realm of a viral syndrome.
Wow. Ladies and gentlemen, that is information you can't find or hear anywhere else but on this program. And Dr. Sinatra, you are a wealth of information, and I want to thank you for coming on to the show. Let me ask you this about allergies. Would you recommend the therapy of acupuncture for allergies, and how would it help?
Well, when people get allergies, sometimes they're miserable. I mean, like myself was miserable. And acupuncture is a way of opening up channels in the body. In other words, facilitating energy in the body. Lots of times energy gets blocked. And sometimes acupuncture can really help because when you're driving energy through the meridians, with needles and whether it's Japanese, whether it's Chinese, acupressure, sometimes can work. Whenever you're facilitating the energy, because whenever you have inflammation in the body, I don't care where it is, lots of times inflammation blocks the meridian channels. And when that happens, then your lymphatics get blocked and the whole system gets blocked. So for some people, acupuncture is a very good thing and it works. I even tried in my allergies when I was in Connecticut years ago. I tried everything. Everything.
Yeah, it's almost like you take yourself and you become a walking laboratory trying to find the answers. And I think for a lot of us, we need to be that way because sometimes, just through trial and error, we end up finding our own cures.
No, we do, and that's what I did as a doctor. Well, one of my favorite supplements for years is N-acetylcysteine because NAC, we call it NAC. It's broken down to glutathione in the body. And glutathione peroxidase is the most important antioxidant in the body for not only the cardiovascular system, but the immune system as well. So when NAC is broken down to glutathione, if we take vitamin C and selenium, now we have the raw materials to make, this incredible antioxidant, glutathione peroxidase, which is, again, we feed our body the raw materials. And another one I like, I've only been using it in the last few years, is andrographis. This is an herb that
Yes.
might have some really good play. I know, which country is it? Thailand. Thailand is using andrographis. Look it up online. They use an andrographis in COVID-19. It makes sense. It's anti-inflammatory. It's antiviral. It does a lot of good things for the body. And I'm experimenting with that one as well. I actually learned about andrographis from my colleagues.
Yeah, andrographis, from what I understand, the origin is actually Malaysia,
Yes.
and that a lot of the studies were done at the University of Chile. And you're right, andrographis, what I love about that herb is that it's great for the immune system. It's great for people who have weak immunity, and it acts as a modulator for those that have an overactive immune system. So if they're dealing with things such as rheumatoid arthritis, fibromyalgia, anything that is autoimmunity, andrographis seems to have an action in which it can bring that overactivity down a bit. And of course, I've seen anti-cancer properties with andrographis as well. And you're right, it's probably a hidden gem when it comes to improving our immunity.
Now, Ward, have you used andrographis on yourself? I mean, do you have
Yes.
experience? And okay, let me ask you this, because I believe in synchronicity, and sometimes this is how God works. You know what I
Yeah,
mean?
oh yeah.
One of the women in my office had a vaccination and developed a horrific reaction to it, bleeding from the lung, in and out of the hospital, went back to the hospital again, short of breath, and it sounds like because she's had a history of sarcoidosis in the past and has sort of a hyperimmune system, when she got the vaccination, everything broke loose. And I'm wondering what you said, because, of your own experience with andrographis. I've been taking it only for the last year, but I'm wondering, in somebody with a hyperimmune response, would andrographis tend to put, a blanket over it?
It actually works to calm it down.
Calm it down. That's
And
what I mean.
I would suggest using the andrographis. The thing is that a lot of people need to realize, and I don't want to get into the political realm here, but when it came to the vaccines, and we end up with 4, maybe 5 different pharmaceutical companies creating a vaccine, and none of them were synergistic. They're all over the place. And then you end up where you have to do so much research on every single one of them, because some of them, you should not be using if you do have an autoimmune condition. There are some that you don't use if you have asthma or you have allergies that are close to being anaphylactic. You don't want that type of vaccine. So the spectrum right now is all over the place. There are people, I have family members that took the vaccine route and the side effects were horrible. But when somebody shows autoimmunity, like sclerosis here, I would look at andrographis. I would even look at using something for that particular condition like hyaluronic acid, because it
Right.
draws moisture into the skin, because with that type of condition, the tissues become very hardened, not just on the outside, but also on the inside. And to keep those things pliable and to keep moisture retained within all the tissues. Hyaluronic acid is one of those nutrients that I would highly suggest. And again, I would highly suggest using Andro gravis for anyone with an autoimmune condition.
Great. What a show. You taught me something, Ward. It's always good to learn something from a fellow colleague, you know?
Well, that's what we're both here for. We come together, we bring the information, and and tell you the truth, I know your heart, I know mine, and we know who our creator is. And all things work together for good to those who are called of the Lord, and we use that to bless everyone around us. So, Dr. Sinatra, you're like a cup that is full and overflowing, and that overflow is that information that is going to bless not only me that you blessed today, but you blessed all of my viewers and all of my listeners. And I want to thank you for that.
Well, thanks for having me, and thanks for teaching me something about andrographis. I mean, I really appreciate that.
Well, you're very welcome. And Dr. Sinatra, where can all of my viewers and my listeners learn more about you?
Well, drsinatra.com is my supplemental, that's my vitamin and mineral nutritional website. I've been with Healthy Directions for over 25 years. Great company, great quality assurance. I mean, I can tell you this, Ward, when they make supplements, everything goes by me. Everything goes by me. In other words, there's not if there's an ingredient that I don't want in there, you got to take it out. I'll lobby for it, and I sleep good at night because our quality assurance program is outstanding. It's like 10 plus. I mean, it doesn't get better than that. So I just feel that I'm blessed working with a company and a great management team and the leadership as well. So it's been a good fit for me.
Well, fantastic. Well, ladies and gentlemen, you've heard it from the doctor himself today. You have received so much vital information to improve your overall health. Also, Dr. Sinatra has given you things such as grounding, or what we call earthing. So go outside in your bare feet today for 15 minutes to half an hour. You're going to notice the difference the first day you do something like that. I guarantee you're going to come back inside and you're going to feel relaxed. You're just going to feel refreshed just by doing something so simple. So God created this earth, so go outside, enjoy it. You can draw from the ground and you can draw from the sun, because there's plenty of vitamin D3 to go around for all of us, and we all know that that works for the immune system. So again, thank you, Dr. Sinatra, for the honor and the pleasure to come back to the show and again share your knowledge.